Blaine, so I've got a question for you. Sometimes people will have a pain in the butt, and that's what we're going to be talking about today. And this one in particular is if my hamstring comes up to my butt muscle or my butt bone. What might you call that? I think there's a medical term for this.
Yeah, the medical term is called Proximal Hamstring Tendinopathy. It's a bit of a mouthful.
Yeah. What do we do for that? Well, first and foremost, what are some considerations if we're dealing with something like this?
Yeah. So it's an injury. It is the top of your hamstring, right, where it connects to your butt bone, like you said. It often happens during sports like basketball, or if someone slips and accidentally does the splits. I've seen that happen before. But it usually hurts when you're sitting down, and like things like running can be painful. So we see it more often in our athletes, but it can happen in non-athletes as well.
All right.
And it's like other forms of tendinitis. We address it by, we try to stimulate the area and improve circulation, and we try to load the tendon. And that loading of the tendon at an appropriate level is what stimulates it to heal.
Those are my favorite things. Just any reason to find another reason to do a little exercising. I'm all about that. So
yeah, I guess one thing I should mention about it is it is a type of tendinitis that can take a long time to heal. So sometimes people have that pain in the just below their butt bone that it can last several months or even up to a year.
So similar to some of our other longer recovery injuries like an ACL tear or something like that, this one, you're in it kind of for the long haul, right?
Yeah, and it doesn't mean you can't function. You can still do things with it. It just is uncomfortable. A lot of times I hear a lot of people mention sitting down is really irritating, which is frustrating because we have to sit a lot.
It's one of those things, I think we talked about this with some of the arm injuries that we have. It's one of those things that you don't realize how much pain you get until you have it happen to you, and then all of a sudden everything, oh man, this hurts. And
yeah, it's easy to take stuff for granted until it doesn't work for you.
Yeah. Well, I'm guessing we have some exercises that'll work with this.
Yeah, that's the good news about it, is there's actually, we'll show 3 or 4 or 5 exercises that can help to heal up a lot faster and re-strengthen that hamstring tendon and muscle.
And because of where the muscle is, I would imagine these are also exercises that might help quite a bit with just your normal exercises in general.
Yeah, it's true. Doing these exercises will not only help you heal faster, but they're great exercises that will improve your athleticism and your functional strength.
All right. Well, let's get to them, shall we?
Yeah. So one of the first and most basic exercises you can do for this pain is just a simple bridge. And this might be a little uncomfortable when you start out, and it is okay to work through some discomfort. If it's really sharp, excruciating pain, then of course don't push through it. But usually most people with a proximal hamstring tendinopathy can do this reasonably well. And so this would be a good beginner exercise if you recently have the injury. Now as that starts to get easy for you, you can do a single leg. So he's bridging up on his right leg only. And so this would be assuming you have the injury in the right leg, of course. And that's a whole lot harder with one leg than it is with two.
Oh yeah.
Okay. And then a more advanced version of this, you can also do this one both double and single leg, is you can use a physio ball, and if you bridge up and kind of balance, and as you're balancing, you'll kind of roll that ball toward you and slide it away from you. This is a very advanced, more challenging one. So if you've recently strained your hamstring, this one might be too aggressive initially, so you might want to get used to the bridges first. But a few weeks down the road, you could progress to this one. Or you could just start doing it with both legs. But this is a great way to strengthen your hamstrings, and it will also strengthen your core and your low back a little bit too. So it hits more muscle than one. Alright. So for our next one we show it, and this one can be done in no particular order. You can start this early after an injury or late into the injury, several weeks into rehabilitation. But this is just a simple hamstring rolling technique, a foam roller. So you can get these foam rollers for pretty cheap at a sports store or online. And you can also, if you don't have one of these, you can even use like a baseball bat or something cylindrical shaped that you can roll on.
An old glass Coke bottle. Add a
Yeah. Yeah, just make sure it doesn't break while you're rolling.
Yeah. Never mind. Don't listen to me. That's a good point.
Yeah. But this is a good technique. And you want to roll from from your knee all the way up to the top of your hamstring, or really the base of your bottom there. Okay. So for the next exercise, a great exercise for your hamstrings and for a hamstring tendinopathy or tendinitis is a single leg deadlift. So on this one, you'll try to keep both knees fairly straight, and you're just going to hinge at the hip. And
Okay, my bad.
there you go. So as you drop your head down, you can kick your opposite leg up. So this would be working his right hamstring.
And this is the left.
Yep, so you try to keep your body fairly straight. This of course works your balance quite a bit too. You have to balance on one leg. But after you do several repetitions of these, you can feel a pretty good strain on your hamstring and in your glute muscles a little bit.
Yeah.
So after you work on this one for a couple weeks, you can add some weight, and you'll just drop the weight down while your opposite leg pops up there. And you can start with lighter weights and advance to heavier ones as you get stronger. But you can definitely feel the strain in your hamstring as you do these.
I think you found an exercise for me to work on, Blaine.
Yeah.
This one is a little challenging.
Yeah, this is a great exercise for a lot of different conditions. It's especially good for these hamstring issues. This also might be one that if you're a high school coach and you have athletes that you're worried about getting hamstring strains, this is a good preventative exercise as well. So this last one is a Nordic hamstring curl. So I'm going to block Greg's heels. This one's hard to do by yourself.
It's very hard to do by yourself. Holy cow.
So you can either have someone block your heels, or there's gym equipment where you can, sorry, I didn't block you really good there.
That's all right.
There's gym equipment where you can tuck your heels underneath and block them for you. And Greg's doing a good job of keeping his body pretty straight. And so this is a great exercise for a hamstring issue. And it's a more advanced exercise, so you probably wouldn't want to try this one right after the injury, but after you've gotten good at the bridges and the single leg deadlifts, you can advance to this one. You feeling the burn in the hammies?
Oh yeah.
Okay.
So some simple exercises, some of them a little bit harder to do, not necessarily difficult, or they're not difficult to imagine how you do it, but it can be a little bit more work to get after those. I imagine there's some sort of medication that you can also use in these, and do you have any thoughts on that?
Yeah, I mean, a lot of people use like ibuprofen for anti-inflammatory after the injury. You want to be cautious with that in the long term. It's not a good long-term solution. And sometimes people that have really severe strains will actually go in and have an injection into the muscle. I'm not a big fan of that, just because having those cortisone injections can predispose you to having other problems in the future. And so the tough thing about these hamstring tendinopathies is they take a long time, several months, but the long-term prognosis is generally quite good. So if you can be consistent with these exercises and be patient for a few months, it usually gets better on its own.
Yeah, all right. Well, thanks a bunch, Blaine.
Yep, happy to do it.